morning. Good morning, ladies and gentlemen, and thank you for coming to this session early in the morning. Today this is the first session of the eHealth Symposium, and this is an area definitely where we need to share knowledge and experiences in eHealth. This session we have 6 presentations. They will be presented in English, but there is Spanish translation. And if I remind you just to put your phones onto silent, it would be very helpful. And I'd like to introduce myself, and I'm Kath Vowden. I'm nurse consultant from Bradford, and my colleague here is Kud Judestrad. Is that okay?
It's okay.
Good. Document on eHealth in wound care. Thank you, Salla.
Thank you, Kate. And good morning, everyone. It's so nice to see so many people here after the late gala dinner we had yesterday. And it's my pleasure to welcome you to the second EWMA eHealth Symposium, the first one we had last year in Copenhagen. In EWMA, the eHealth has been under the discussion for years. We know it is important, and we have input in that. But the concrete activities for eHealth were established when the EWMA became a partner in the European Union project United for Health, which is actively working to overcome the barriers for increased use of eHealth solutions in wound care context, to the benefit of the patients, the society, and the clinicians. EWMA's role in the project is to demonstrate how knowledge about eHealth can be communicated to an international multidisciplinary audience in the healthcare clinicians. And this model for cooperating is adaptable also to the other areas of healthcare, for example, in care of diabetes. eHealth as a topic in healthcare should no longer only be discussed among policymakers and administrators, but also among health professionals in clinical context. It's time to involve and engage the clinicians on the floor if we really are meant to integrate the technologies in day-to-day care of the patients. In policy and administrative level, eHealth and telemedicine are described to have a central role in solving many of the challenges in healthcare systems, like aging population, increasing incidence of chronic diseases, like diabetes, COPD, cardiovascular disease, and neurological disorders. Growing demand for more responsive, high-quality services. Trends to provide more treatment in home care settings, and push for implementing cross-sectional and multidisciplinary collaboration. And aim for more cost-effective care. To be a solution for these challenges, eHealth need to meet the needs of consumers, which are, in one hand, the professionals, and on the other hand, the clients and the patients. The question is, what do these new technologies has to offer in the field of the wound care, and how we can expect that the care delivery would be changed? The answers for these questions are possible to find only by involving the clinicians in the development work of eHealth technology and their implementation to practice in everyday work in healthcare. In the United for Health project, EWMA has 2 main activities: to host the eHealth Symposium, which we now have here and have had earlier in Copenhagen, and we'll have the next symposium in London 2015. And to produce the eHealth Guidance Document, which is supposed to be ready to publishing and launching out 2015. With the guidance document on eHealth in wound care, EWMA wishes to offer wound care clinicians a brief overview of the main topics to be concerned when integrating eHealth and telemedicine into day-to-day wound care practice. The guidance document will be a starting point for the better understanding of eHealth and wound care sector integration, and to in a way give a common language about eHealth within the wound care community. The guidance document will also serve as a useful tool for clinicians to get a rapid and structured overview of the key issues, including the benefits of the eHealth technologies and the barriers to their implementation in daily practice in wound care. The EWMA is defining the author group for the document, and it will be the mix of the EWMA Council members and also the Australian Wound Management Association, and the external experts within the field of the eHealth and wound care. And yesterday we had the first meeting about discussing that, and it seems to be very promising and inspiring work we are doing together to get this document done. Timeline is so that the manuscript is ready for the publication in spring 2015, so we don't have that much time to do that great work which is expecting to be done. And this document will be presented and launched at EWMA Conference in London 2015. So I'm looking forward to new innovations, easy-to-use solutions and applications of eHealth into the day-to-day care practice of the wound cares. And I hope that in these sessions you get the inspirations and you had also good discussion about this subject. So thank you.